Now we can go, yeah? So look, first I had the opportunity, I think last week, we get together with these amazing human beings on panel, and after half an hour Zoom call, I left totally inspired, and hopefully all of you can leave with the same kind of inspiration that they gave to me last week. And I think that, you know, for those that has been in the Hispanic Leadership Summit in 2020, we know that we have some priorities, and one of them was a good wealth, wealth, being, and good health. And so that what we want to really is generate a dialogue for actions. And with that, I want to start with Lisa. Lisa is Director of Civil Rights in the U.S. Department of Health and Human Services. Lisa, I would love for you to start talking a little bit about how can effectively we can act to combat barriers that the Hispanic community face regarding good health and well-being. And if you can elaborate specifically on civil rights.
Okay. Gracias, Fernando. I thought we were just going to dance for 45 minutes, so no, that's cool. Hello, everyone. Bienvenidos. ¿Cómo están? ¿Cómo están? Yeah? Fantastic day. Hi, I'm Lisa Pino. I'm the Director of Civil Rights at HHS, recently appointed by the Biden administration. Absolutely honored to be here. Claudia and we are all human. How can we overcome barriers? So I'll give you one perspective. I'm a first-generation daughter of immigrants. I was born and raised in this magnificent city, and I was propelled to look at social justice. My dad, who's a tailor, he still works this day. He's going to turn 80 very soon. On the job, he fell and had an accident that almost impaled his leg for life, and he has had a severe disability. And that propelled me to look at a path in social justice. And at the Civil Rights Office for HHS, you know, my job and our team is to make sure that everyone in the American public has the access that they deserve to any federally funded program or activity. So that's, you know, if you're taking your abuela to the hospital and she's a Medicaid or Medicare recipient and you ask for translation assistance, which is required under Title VI of civil rights laws under limited English proficiency, and she doesn't get that, she doesn't get that interpreter, that she doesn't get that assistance, or she doesn't have assistance that's culturally competent, you can file a complaint in my office, and we will review and investigate, because the job is to overcome barriers. We have to speak up. We have to point out where those injustices are, and so our charge is to make sure that civil rights are enforced across the HHS diaspora, and that is most important right now due to the disproportionate impact of COVID-19, which has only magnified health inequities. So that's one way of overcoming barriers, is like being active on policy, writing your elected officials, filing a complaint when you see injustice, following it through, and being able to be engaged and participate in that national policy-making process that happens in Washington.
Thank you, Lisa, and thank you so much for your day-to-day work, because we are really counting on you and many of you that are really making a huge difference for all of us. So thank you. Round of applause. Yeah. Now, today I have and you know, my name is Fernando González Salinas, yeah? So it's a lot of González for sure around here, yeah? So I met Mauricio today, Dr. Mauricio, and he was dubbed as the Latin Dr. Fauci. Yeah, many of you know that, and he has been extremely active during the pandemic. So, you know, I wanna just you, Mauricio, to share with us a little bit of what you have been doing during the pandemic, and more important, what are the initiatives that you have been taking on to really, you know, overcome these barriers.
Gracias, Fernando. Y hola a todos, bienvenidos, gracias por bailar con nosotros. Si no, me iba a sentir muy mal. I think we've made amazing strides in terms of healthcare for the Latinx community. That's quite clear. But there's one major area where we urgently need to improve and step up, and that is preventive medicine. And in order to do that, there's no way around it. We need to build trust, communication, every single day, every single hour, every single minute. Okay? Unfortunately, evidence-based information reaches the Latinx community too slowly and too late. And I can give you an example of that. The CDC estimates that we have in the United States 4.4 million Latinos suffering from arthritis. But here's the thing. Arthritis is not common among Latinos. We actually have this disease in less prevalence than non-Hispanic whites. The only difference is that Latinos are twice as likely to become disabled from this disease. And you know why? Because vital and evidence-based information reaches our people too slowly and too late. So I came to this summit with one major proposal to all of you. We need, I don't know how you guys are going to make it, but just please do it. We need the public and the private sector to come together in a concerted effort and detect key trusted actors within our communities, professionals that people love, and start establishing an agenda where we provide evidence-based information all year long, especially on social media, where most Latinos nowadays obtain their information. Gracias.
Gracias, Mauricio. So we just celebrate, I think, with Claudia and Michael, the program on health and the nurses, and we have the privilege to have Dr. Kathleen Gallo here, and she has been really an icon on advancing access and education. So, Kathleen, I want you to share with all of us all the initiatives that you have been leading, and professionally and personally, that I, for sure, a lot of us could learn a lot. Thank you.
Thank you. By background, I am a emergency and trauma nurse, pre-hospital care and emergency management. And just little fun facts. There are over 4 million registered nurses in this country. It is the largest professional workforce in healthcare, among one of the highest paying careers in healthcare. Out of that, over 4 million registered nurses, under 6% are Hispanic nurses. So there is clear evidence that the connection between a diverse and culturally competent nursing workforce leads to high-quality patient care in an effort to decrease healthcare disparities. So traditionally, for nursing schools, you receive your applications, you go through whatever the requirements are, you interview, you admit. This doesn't work anymore. What we've done so it's Northwell Health and Hofstra University have started 2 schools, a medical school and a nursing school. At the nursing school, we just started our undergraduate program. We have doctoral programs leading to 3 nurse practitioner specialties, plus certified registered nurse anesthetists, which their starting salary the day after graduation, at a minimum, is $185,000. So what we've done is outreach, not wait and be passive for applications to come in. We have a pipeline of program that we've established. We received a 4-year federal grant this summer. We partnered with a high school in Uniondale, in Hempstead, which is an underserved area. We expose these young folks, both men and young women, to nurses at Northwell. Bring them into our clinical simulation center. Give them a stethoscope, hands-on. Let them be excited about nursing. Have them look at our nurses. You can be this. It's a matter of access, mentoring. We help them with the requirements of how do you, the admission process into a college. We try to close the gap for any social determinants of education that they've experienced, and then mentor through through their whole academic program. You start off. There was one speaker up here under the quality of education topic. She talked about baccalaureate degrees. I 100% agree with her, because it's the way to advance in a nursing career. Once somebody goes and becomes either an LPN or has an associate degree, it's very hard to get back to school to now finish up and advance your career. Funding is critical. A barrier is tuition. And fortunately, with the generosity and this Hispanic Star Alliance, 50 Hispanic nurses right now are getting support for their tuition, as well as our mentoring initiative. This is vitally important. Our goal is that when our students graduate, one, they have a job right at Northwell Health. We just don't say goodbye at graduation. They're always in our hands. Undergraduates, bring them back, put them through graduate degrees. They work at Northwell, bring them back as faculty. So there's a whole career path that can happen. But it requires reaching out to the Hispanic kids in middle school and high school, exposing them to what the opportunities are, make it fun for them while they're in high school, and then help them to achieve academic success. So that's one of the things that we're doing. And actually, our student body now, we are 53% with unrepresented students. 25% of that group are Hispanic nurses.
Thank you, Dr. Kathleen. And look, we have been talking all day about commitments and action, and this is truly action. So I just want to, again, a round of applause for Kathleen and Northwell. Claudia, thank you. Because these are concrete, and these are 50 and more people that we will change in life and coming now. So thank you so much. So we have Eric, we have Rob, the CEO of Action for Healthy Kids. And I was very impressed, Rob, when you were talking about your organization and what you do. And I would love for you to share with all of us, some of the initiatives and some of the things that we should continue to do, or maybe start doing or stop.
Great. Well, first I want to say that I'm just humbled to be here with you today. And I'll start with two very quick personal notes. Number one, my organization, what we do is we work on nutrition programming and social emotional health programming and physical activity programming. So as a physical activity organization, I have been asked to dance on stage in front of groups of people dozens and dozens of times. You would think I would be better at it at this point, but I'm just going to keep plugging away. And to stick with the dancing theme, again, one quick personal note, and then I'll answer your question, my daughter has been a dancer her whole life. She's a classical ballerina. She's now 17 years old. And every year, we have a celebration toward Christmas because she is in the Nutcracker. And she's been doing it since she was a little tiny girl, 4 years old, I think, something like that. A year ago, she got 2 stress fractures in her spine. For months, had a brace on, and she's been recovering ever since. Thank goodness, she's back. And last weekend, we went and we watched the Nutcracker with my daughter in it. And she was telling me before she went to her performance that she was nervous because she hadn't been able to put in the same amount of work that she had been able to put in before when she was healthy. And so she didn't know if she was going to be able to execute all of her moves. And so I told her before the performance, and it's ringing true today, that we admire people who achieve perfection. But we fall in love with people who show their passion. So this is going to sound like I'm sucking up, but I have been falling in love with you all day long because of your passion. It has really been just captivating. In terms of the answer to the question,
I think you all know this. You would have to live under a rock not to know that we are facing a child health crisis. It's not only physical, and many years ago we knew about the obesity epidemic, but the social and emotional tolls pre-pandemic that our world has put on kids are astronomical. Think about the mental health issues they're facing, substance abuse, depression and anxiety, bullying, all the way up to, and I think this is the most terrifying of all as a parent of 3 kids, suicidism. The suicide rate for 10 to 14-year-olds has tripled in the last decade. And the Hispanic community, unfortunately, is experiencing some of the worst, biggest challenges. The diabetes rate and the obesity rate for 2 to 5-year-old Hispanics is 5 times that of white Americans. So we are facing a huge challenge. What do we need to do to counteract this huge challenge? There's a couple of principles I'll talk about. There's lots of great programs out there, but the principles are, Mauricio mentioned it a moment ago, prevention. Not just preventive medical services, prevention in schools for kids, starting at least at pre-K, even younger, hopefully. Extremely important. There's a model in the work that we do called the whole child model. It's backed by the best evidence of in the world from the Centers for Disease Control and Prevention. And we need to be employing this program to make sure that whole child health is winning the day in schools. And the second thing, this is the last thing I'll say, I'll turn it back over, is it needs to be community oriented. All of our programs need to start at the community level. And they need to, in terms of schools and kids, need to include parents and caregivers. Because if we don't include parents and caregivers, then relationships are king. If you don't have parents and caregivers working with school stakeholders, then you have nothing. So those are a couple of the principles that I would refer to.
Thank you, Rob. Thank you. So look, yeah, totally, Mauricio. I think that you have heard, starting with Lisa, what at the national level the government and all the initiatives that she's leading and how important awareness is for all of us and to help on civil rights. Then Mauricio talked a lot about, how important is social platform and technology on helping on prevention and how we can get out, and not only in the United States, but his connection in Latin America. And then Dr. Kathleen talked about the access and education, how that can change. And at the end, Rob talked a lot about, how family and the support system around. So I would love for us, as we are getting to the end, to share some reflection with the audience as we are getting, at the end of the panel. Kathleen, do you want to start?
I think there's a commonality with all of us. When you're talking about prevention, I'm thinking we'll give him nurses, right? I mean, what happened to the public health nurses? They've disappeared. So I think, collaboration is probably one of the best things that we could do to make a difference of magnitude. But I think it's more about outreach, and as Mike Dowling said before, it's not doing things the traditional ways, because those days are over, but actually responding to the new normal. And never taking your foot off the brake. This isn't like something that we're going to do for this year and then we'll move on when something else happens. My one reflection about everybody speaking, especially, Lisa, when you started, I'm thinking, what do you mean no interpreter? Right away I'm thinking of that, right? Like we all have the same commonalities in terms of targeting the same issue. And, I have no doubt that we will all be making a difference and affecting a very good outcome.
Thank you. Yep.
Yeah, great. I'll double down on one thing I was just saying. The model that we employ with my organization is called Family School Partnerships. We came up with an idea about a year ago, or a year and a half ago, that I think changed the whole dynamic of the program. instead of relying only on volunteers, we've now started to pay people we call family connectors that are in communities that have relationships and trust in those communities to foster relationships between parents and caregivers and their school and school district. And I think those relationships, if there's one thing I would reflect on and say that is really critically important, is it is those relationships at the local community level that make such a huge difference and has really unlocked a lot for Action for Healthy Kids. And the fact that we're paying them makes them an economic development, makes it an economic development program too. It's not purely volunteerism. And so I think it's those kinds of innovative ideas that we need to look for that hit two bottom lines, not just one, that are really critical.
Gracias, Rob. Lisa?
The panel is addressed to health, wellness, and what's fascinating about public health is that it reflects the inequities or equity of our societies at large. If you look at the social determinants of health, a family, nuestra familia, we can't be healthy if we don't have fair, affordable housing. We can't be healthy if we don't have a right and access to good education. We can't be healthy if there isn't public transit in our door that's affordable and safe. That's the lens of health and social justice. So I say, hay mucho para seguir luchando. We have to keep going down the road, and whatever it is that touches your heart. Are there any future lawyers out there? Show me the lawyers. Who's applying to law school? Who's taking the LSAT? Nurses. Who's going to apply to that program for 50 scholarships? Right? Who's going to go to medical school and take the MCAT? Who's going to file a complaint that's going to go to my office one day because abuela didn't get the limited English proficiency guidance and translation that she needed? Right? All of us take action. All of us keep fighting. Being able to have access to health care is a human right, and we have to keep going. Thanks, Fernando.
Gracias, Lisa. Gracias.
It's truly remarkable how our principles, values, and they align perfectly, no matter in which place we are. I want to close with a personal story, because if we don't share this, we will never understand. I have a dear friend. This is a true story. She called me early January, and she said, Mauricio, I saw that you got the vaccine. I'm quite hesitant. And I was like, we have data. The data shows extreme safety and efficacy. Okay, she never got the vaccine. She truly hesitated because of things that she saw on social media. She got COVID. And now she's been dealing 7 months with long COVID symptoms. MRIs, neurologists, there's nothing we can do. So this information kills people. It does, little by little, in isolated breaks, but it does. Think about our family members who don't want to get a mammogram or a colonoscopy, or don't want to get vaccines because, I don't trust those things. Evidence-based has to be married with emotion and trust. So if we are able to unite these two entities, our future looks bright. And remember, together we conquer, together we shine.
Gracias, Mauricio. Hopefully you can feel the same that I was feeling last week when we were together. And, we have a family tradition, which is a Christmas kind of wish. And I'm going to use it now. So then my kid's going to kill me, but it's fine. I'm going to use it now. I truly wish that, we have more Mauricio, more Lisa, more Rob, and more Kathleen, so we can have a better world for all of us. Thank you so much. Thank you, guys. Thank you.
Thank
so
you.
Much.